Okay, good afternoon everyone. Today we are presenting a case of congenital heart disease. What we should see, how to take the history, what is the examination, how it asked in the examination, what are the various questions and answers. With me here is Dr. Manogna, who is our DNB secondary resident, so who is presenting the case of left to right shunt in congenital heart disease. What are the presentation and how we go ahead with the case and what are the various things asked in exam, we'll discuss today. So now over to you, Manogna. She will present like a typical format of examination, and then we have students with us who can ask the questions and we can give the answers, so that it will be beneficial for all the exam going and who can see this video. Okay, now over to you, Manogna.
Child name is Mokshit, the 7 months old male child, informant being mother, reliable, hailing from Nirmal, presented with complaints of poor weight gain and recurrent respiratory infection since birth. Coming to the history of present illness.
You told two symptoms: recurrent respiratory tract infection and poor weight gain.
Yes.
So once you assess these two patients in context of suppose heart disease or any other illness, what will you take on that? Why recurrent respiratory tract infection? Why poor weight gain? What does it indicate?
Increased respiratory infections means that is increased pulmonary blood flow, sir, which is...
No, that's not the only case. Once you're doing any pediatric case, in the beginning you don't know it's a congenital cardiac heart disease. You have to tell there will be many different reasons. Some may be allergic, some sinusitis, gastroesophageal reflux. So now my question to you, what is the incidence of gastroesophageal reflux in infancy? Usually, exact incidence you see, but usually by 90% they will resolve by 1 year. More the preterm, more the incidence. So that is also one of the very common causes. Other causes you can go from the first to last, like from the lung causes, any bronchopneumonia, bronchiolitis, sinusitis, upper airway problem, lower airway problem. Coming to the cardiac problem, then it's a congenital heart diseases. And coming to the gut problem, then it will be diaphragmatic hernia, diaphragmatic TET, late presentation of TF. So many other things are there. So once somebody present with the recurrent RTI, you should not see yourself as only cardiac, but other cause you have to rule out. So poor weight gain, what does the poor weight gain suggest?
Either intake is less or whatever he is taking is being utilized for some other
very good. So if intake is less, then here the nutrition needs to become very important. Second thing, if his expenditure is more than intake, so whatever the cause, whether it is in CCF or some lung infection or is a recurrent RTI, reflux, okay, or some congenital IUGR, where even from the IUGR, it is a symmetrical IUGR, will go continue to have poor weight gain, or some dysmorphic faces. So if the poor weight gain also, you have to think of all those causes, whether it's a recurrent lung cause, CCF, any infection, any reflux, any symmetrical IUGR, or